It is my pleasure to introduce our next speaker, Chef Cary Neff, who I like to call an honorary dietitian, because he's all but got the degree, because the knowledge is all there. His philosophy of conscious cuisine. Chef, when did you write that book? 2002. It's a beautiful book that really looks at beautiful food that happens to be healthy, as opposed to just healthy food that is okay, right? It's really about the food, because chef first. Sorry. So Chef Neff is going to speak to us today really about how chefs and systems can work together and how we can really get this change to happen. So I'm really delighted to introduce Chef Neff. How many years in culinary? Forever. Restaurants, like I said, book. He was with Morrison's Healthcare for 13 years and now has his own consulting, Conscious Cuisine, really to help food service change. Chef Neff.
First, I need to give a shout out to Dr. Agarwal. Where have you been my half life? And what you just heard from her not only was spot on, but it was half of what is really true. As in the resistance, as in the naysayers, as in how bad the situation really is or can be. When I joined, let me give you a quick overview of what's happening and some of the things that where I would like to speak about today. First of all, of course, I made a presentation that I changed dramatically over the last 2 days. I was absolutely, just blown away by Dr. Agarwal, and I really wish I would have been able to connect with her while I was still inside healthcare, because that's the type of change agent that is necessary to make the momentous change. But some of the speakers yesterday, Jacqueline Album, Dr. Album, Dr. Ariz, and also Karen Washington, I missed her presentation, but I had an opportunity to sit and have dinner with her on my first night, and she's absolutely phenomenal. And one of the things that I got together, as in the notes I brought down, was that partnership between healthcare and culinary and also farm. But I think it's much greater than that. It's a partnership not only with the physicians and the dietitians and the chefs and the community in the hospital, which to me is a wellness hub in every community. All right, but it's also about the farm and the food, and it's also the government intervention. And not only is that a partnership, it needs to be a holistic partnership, because it isn't just one branch really trying to drive it. It has to be complete. As you just spoke, we just heard from Dr. Agarwal, who just showed you that there's a health conscious menu, and now they're going to implement it inside the cafe. It needs to start all the way around. What was so phenomenal when I had the opportunity where we were successful, I was able to show that what your patient, what your mom, what your dad, what that patient is eating is the same thing that's served in the cafe, which is the same thing that the doctor is eating. That's extremely powerful. It's powerful to show that there's a change, and there's a change in the attitude of what we're going to do to prevent this from happening again, and how we can change our lifestyle. And it's really how I really began getting involved in this. I realized in my earlier part of my career, let me get this going here. In the earlier part of my career, I worked in a number of restaurants, studied in French cuisine, and understood the roots of fine dining. And one of my early mentors really imposed on me how to anticipate the needs of my customer. So I was always trying to make sure that I was providing you with the best experience and the things that you most aptly wanted before you were able to describe and think that way. And so as I continued to grow my career, I found that I was working in a upscale Southwestern restaurant in Scottsdale. That not only were we making great food in this award-winning restaurant in the fine dining, but our casual dining was also very, very busy, and our piano bar was also very, very busy. I mean, we were a very upscale restaurant when I would do their catering inside their homes, and I realized that many of these customers, my customers, rarely use their kitchen. In fact, I know that oven had never been turned on. Okay. Right? But the other fortunate part is that I've seen these customers 2-3 times a week, not 2-3 times a month. And so with my training, I questioned myself, was it responsible for them to eat the foods that I'm serving on a daily basis? All right? I finished every sauce with butter. Why? It gave you a great mouthfeel. All right? It gave you a great shine. My point was to make sure that I satisfied you to a point where the greatest compliment that you're taking a piece of bread and forgetting the core and you're sopping it up. Okay? And something that is going to give you a taste memory which you came back. I made sure that I had wonderful rich stocks and reduced glosses and butter imported from France. And I prized myself on being what I called a FedEx chef. If I didn't have what you wanted today, I will have it tomorrow. In 24 hours, I will get it here from anywhere in the world. All right? And that was to satisfy my customer. And then I questioned, was that responsible? Okay? And so I got away with the rendered duck fat on the saute station. I used that because it had more flavor. I got away with the whole butter on the saute station to finish items because it gave it more flavor as I basted the items. And I started using more herbs that I planted. I started looking for the local farmers that was in the Arizona and the New Mexico and the California area that I can get organic vegetables and seasonal vegetables. I started deciding on where was my protein coming from and how was it raised and where did I get it. Okay? And so I also knew that it was, as I changed my menu every season, that I was going to make this change because I felt that this was best for my customer. Okay? Whether they know it or not. Okay? And it was my responsibility to make sure that they have that. But that's not why my owner hired me. And that's not why the young men and women came to work for me. Okay? So I didn't tell anyone. Right? And I replaced 3/4 of the menu and I kept some of the mainstays. And I was able to come to your table and let's say it was a 4-top and 3 of you ordered items that was appealing to you. There's some things that I learned early on in my career. I was fortunate enough to work at the Park Hyatt Hotel in Chicago as a young sous chef. And we thought of this idea of health-conscious cooking in the early 80s, and we called it cuisine naturelle. And we put it on the bottom of the menu, and no one ordered it. And then as a young cook, this was the items that I prepped every day, and no one ordered it. And why am I wasting this food? So I put no love in it. I hated making that item. Then I went over to the Four Seasons, and we did the same thing, and I forget the brand that we did there. But again, the bottom of the menu. I think we had a Heart Healthy logo on it. Okay? So again, no love on it. So I decided I'm not going to do that. I'm going to make sure the menu is embedded throughout the entire menu. There would be no insignia to say that this is good for you or have done different. It's just food. Okay? And so the other thing is I'm going to change how I write my entire menu. So at that time, part of the Culinary's philosophy was of marketing. Marketing was our menu. And we would market that this was an Angus beef, this is 12 ounces of salmon. That was our marketing. Food cost was a part of marketing. Okay? I would have a higher food cost by giving a larger portion, so therefore you felt it was a value. You would then say, I had so much food, I would bring it home. You would come back. All right? I decided not to do that. I'm going to give you the right portion size that you're satisfied now. I'm not encouraging the doggy bag. And I'm not going to tell you the size and the ounces of the food that's on the plate. But most importantly, I'm going to describe my dishes, what's important. So today, give you an example of just a meal just recently. I went to the store for my family, and I saw morel mushrooms, I saw royal trumpet mushrooms, and I saw kale. So the dinner tonight was a toasted barley risotto with wild mushrooms and kale. Then I complemented it with salmon. Or I could have complemented it with chicken. Or I could have complemented it with beef. Or I could have complemented it with tofu. Or I didn't have to complement it with any animal protein at all. Okay? And so the point is that those morels is only in season right now. And it tastes great right now. And the greens that I added is what's going to bring it together. And I want a fully balanced meal. I can now look for an edamame bean or another type of bean to give me that protein. Or for here's a wild Alaskan salmon, that's enough. But guess what? Now let's go down to 3 to 4 ounces. That's all I need to balance this meal to complement it, rather than 10 ounces. So what had happened was I was able to go to your table and explain, where's the beef? Where is the complement to that? Oh, I see it on the menu now. So now the diner had to change how they read the menu. They didn't see salmon, chicken, beef, pork. They saw vegetables. They saw whole grains. Okay? The doctor also told you, when she gave you those numbers, honestly, doctor, those numbers are wrong. I can guarantee you they can fix the numbers. Your meal was not $2.80. Right? It is cheaper to make vegetables and whole grains than it is to buy beef. Believe me. Okay? All right? And so I proved that 100 times, as in the reason why I'm here is that I've started something, and I was asked to consult for a large food service organization, and the idea was, can you help introduce healthy eating and change and provide that healthy eating can be not only good for you and taste great? I said, absolutely. My brand is Conscious Cuisine, and we're going to make that happen. But I've been in the restaurant industry for a long time, and people are afraid because we did a horrible job as restaurateurs, as marketers, as in introducing what's good for you. Okay? And remember, what I mean by doing a horrible job is that early on, the healthy food items was a rice cake. Okay? All right? And so now, in order for me to eat healthy, I need to eat this boring, dry, tired item. But it's good for you. Put a little peanut butter on it, it may be all right. No, it's not. It's still a rice cake. All right? Then we went to the other direction, and we made these wonderful snack wheel cookie. And it is really low in calories, but not if you eat the whole box. Okay? And so what I said, if I created a concept called Conscious Cuisine, there's going to be naysayers in that car who's not going to come. All right? If there's a car filled with 5 is saying, I'm not interested in health-conscious cuisine because you know what? Probably in order to make it nutritionally satisfying, they took out the flavor, the fat, the calories, the things that they assume that is flavorful. Okay? So most of those people, those customers, will naysay it before they even try it. Okay? So I created a concept called Flavors 450. Right? And this is a action station inside a hospital cafe and also inside a school cafe. They introduced that this is going to be bursting with flavor, 450 calories, and under $5. Most of the items are $4.50. Okay? So that meant that you can eat healthy. This attacked every negative connotation about healthy food. 1 is too expensive. No, it's not. It's under $5. 2 is going to be boring. No, it's not. 3 is going to have less flavor. Let me show you. Try it for the first time. And then 4 is going to take way too long in order to make this. I'm going to make it to order. And so what the menu was how do we create a menu with the seasons? So that meant that we're going to feature these bowls, these grains, and I was introducing quinoa for the first time, beets for the first time, kale, all of these different vegetables, and people were having an opportunity to taste them safely, and then before they order it. When we offered the protein, all right, it was put on a skewer, which I called a sword, but it was a tofu skewer, a salmon skewer, and a chicken skewer. Right? And then that complemented this grain, this vegetable stir fry, and those items. All right? That became won an award for best new concept at that time in 2009. We introduced that now inside the rest of the healthcare and education organizations. So I say that to start off as in it can be done. But the opportunity of it happening, it takes a collective effort of all of us. We can't sit on the sideline, and we also can't do it one at a time, right? And so I tried extremely hard for a very, very long time, and I think it's now really time to go to the next area of urgency. And I'm going to share with you some of that sense of urgency. What I mean by that sense of urgency is not as us being professionals, food service professionals, and physicians, and mothers, and fathers, and farmers. We need to be more vocal in demanding it. And then as I go through this presentation, I wanted to share with you why the sense of urgency in the time is now and what we absolutely have the opportunity to do. But first of all, let's talk about what's happening inside our hospitals. So hospital food is defined by the public as substance. So that means that the doctor is ensuring that this person gets the right amount of nutrients in order for them to get be discharged. How many nutrients are they receiving? They also, as the customer, they're defining it as boring. Can you bring me some food in? I don't really want to eat this, right? And oftentimes they find that they feel that it's dissatisfying, and so they're sneaking in the burger if they possibly can. But there's an absolutely reason for it, because most of the time it's bland and it's boring because there's no real love inside. Remember when I told you I was a chef in this fine dining restaurant and I didn't put the love in? Well, those guys who was working in the hospital weren't working in fine dining restaurants, so they put less love in. But here's the opportunity where it can be. Where that substance is, it can be nourishing. Where it was boring, it can be celebratory. Okay? Because now we're celebrating not only food and flavor, but we're celebrating life and energy and our new life and opportunity. Where it can be dissatisfying, it can be gratifying. Okay? After surgery, here's I failed at this. I tried for 8 years to make sure that this happened, and I got some of it through in a manner, but not as great as I wanted. I just wanted a clean bone broth. Okay, there's truth in the matter that chicken soup is grandma's penicillin. It's absolutely true. The nutrients, the albumin, the protein, the amino acids inside that broth is so good for you, as well as beef, as well as a nourishing vegetable broth, and the umami from a mushroom and kale and seaweed broth. Broth is so nourishing for you. But before surgery, you're in a clear liquid diet. After surgery, you're in a clear liquid diet. Most times when you have to have major medical procedures, you haven't eaten. So your first meal having this nourishing soup, and the first thing you're going to get, it's going to excite all your senses. You're going to get this smell, this aroma. You're going to get this mouthfeel of this heat. You're going to get these tastes of these fresh herbs and broth. Now, should it be a base? That's out of a jar? That you just add a little bit of water to it? Maybe they had not enough water, it's too salty. Maybe they had too much water, it's too bland. You follow me now? Okay? And every patient is getting it. That's getting this in and out of surgery. Easy item. And believe me, it does not cost $2.87. Okay? And so there's tremendous opportunities where the flavorless and the bland can come to tasting and craveable, right? And the education can happen. There's opportunities where we can, I don't know where that came from. So our opportunity where I was speaking about is our job is to become that change agent. I believe that I've always tried to be a change agent, encourage change within my organization and my team members of using your creativity to express yourself and show me what you have, all right? And play, because it's food. And so there was no restrictions for the young staff that I had working for me throughout my entire career, and as I continue to try to make that change. And so that's moving. That change is really challenging the status quo. What they were saying is impossible. As the doctor was just sharing with you, the first thing she got was the resistance of what cannot happen. And when I share with you that the story is so much more and worse, that's why I was introduced to. Right? I was told that you don't understand, you're the celebrity chef from hotels and restaurants, and this is what we do in the hospitals. This is how we've always done it. Okay? And that, we need to have biscuits and gravy on the menu because, that's what they want. And and is a client request. Yes, we must have scrapple on the menu because, this is what we're used to. Okay? Yes, we need to have a hot dog on the menu and not only serve it on the patient menu, but also inside the cafeteria because, we need to make sure that they eat and the people are satisfied. Okay? And so I challenge all of that in this status quo and said that, there's an opportunity to create a Mediterranean menu. And here's the reasons why a Mediterranean menu. The Mediterranean menu is focused on whole fruits, vegetables, and whole grains. All right? And utilizing animal protein as a complement when you choose to use it. It's utilizing fresh and dry spices and herbs where you can reduce the amount of unnecessarily needed salt. You're finding the flavors. One, the flavors that fruits and vegetables and whole grains are in season, so therefore it requires less seasoning. And then two, you can use herbs and spices to enhance it. And then three, let's work with our manufacturer and make our own salt-free spice blend and make that happen and show that and introduce that so they can have different habits when they go home. Let's complement that with videos and show them that there is this is what you now have been diagnosed with diabetes. This is life with diabetes. This is your menu plan with diabetes. This is how you go shopping. This is how you make your meals. And the same thing for cardiac and hypertension and so forth, and having that available for the patient. The point is that education is so important to go along with the food because we are now changing mindsets as well as we're changing lives. So we're moving from the idea of being impossible to do to being possible. I recognize this and saw this happening many times before. I was asked by Barbara, when did I write my book? And it was in year 2000, I recall now. But in 1995, I got involved with this organization called Chefs Collaborative. Any of you guys remember that? Well, Chefs Collaborative, when I first got involved, I was working at Merrillville Life and Balance Spa in Tucson, Arizona. And we became the number one destination wellness spa in all of North America. And that's when I created Conscious Cuisine. And the point behind that is how we can eat mindfully and utilizing foods and cooking with the seasons. And then as I was getting dressed one morning and saw on the local news or cable news of CNN, and they were talking about GMOs and how remarkable that they're able to make this tomato, this perfect tomato. And they just use a little splice of a monkey gene. Okay? And I was outraged, as in, that's in my food? And how do I know that? All right? And so the point was, back at that time, GMOs was really becoming was being introduced in a high rate. And many of our chefs, such as Alice Waters and others, wanted to know if we were buying fruits and vegetables that was genetically modified. So we know not to buy it. That's all. Okay? And so basically FDA said we're not going to label those items GMO. Right? And so the petition and the fight was, if you're not going to label the GMO, how do we know our items are clean and if more so organically grown? This is how the organic laws were created. It was created by a group of chefs who signed a petition, who went to Washington and created a collaborative that said we want to know where our food came from and what it's about. These are some of the guidelines. First, starting out with our why. And I love this opportunity today because every one of you here really has defined what your why is and why you feel it's important that we have food that is fundamentally better for our health and our wellness, for ourselves, our family, and our patients. Food is fundamental to life, the nourishing our body and our soul. Food begins with unpolluted air, land, water, environmentally sustainable farming and fishing. Okay? Food choices that emphasizes delicious, locally grown, and seasonally fresh, whole, and minimally processed foods, supporting local farmers. Cultural and biological diversity. Right? It's so important that we meet our customers, our patients, where they are, who they are, and respect them, not only to learn as a chef to make great foods of different ethnic profiles, but in order to make sure they eat it. Continue to educate ourselves about sustainable choices. Chefs can serve as models in the culinary community and the general public. The greater community can be a catalyst for a positive change. Right? And that's probably the single organization I'm most proud of in my entire 45-year career inside Foodservice, because we made a change. Right? And so, is the organic laws perfect? No, but I know what I'm buying now. Okay, all right. I have a better opportunity. There's a much greater respect for local farmers. But let me tell you what the pushback was. New York Times articles and many other publications. Who do these chefs think they are that's going to tell us what we can and cannot eat? Did you not remember that from when Michelle Obama was doing the Food Initiative, saying that as well? Who can tell us I can't have soda? Well, you know how much sugar is inside that we're putting inside and sodas inside kids? So maybe we should pull that back. Just being responsible doesn't mean that we're taking away people's rights, right? Being responsible is doing the responsible thing, okay? All right? And so my point is that we have to stop talking. We have to stop doing the little one-offs. And we need to work together holistically, collectively, and make a monumental change. Break the damn yoke. Okay? And be afraid to, and not be afraid to. Right? And so by doing that, we have to, and I have to, I'm sorry to digress, but I have to say this. You know what I mean? There's laws that's made up, and right now we're talking about gun right laws, and I thought we had enough at the Sandy Hook, and now what just happened in Texas, and we're still not. It's still okay to buy an assault rifle, okay? And it's in law. Well, but there's a law that says I can't drive. There's a speed limit. I would like to go 100 miles an hour when I'm in a cool sports car, but is it responsible? Is it responsible? So the point is that I want to get to is the responsibility on us as in working together and acting together is to understand that with this responsibility and call for action, the things in which we can do to make a momentous, positive, and long-standing change, right? And that change starts with understanding where we are. And so I brought up that horrific massacre for us as a community of Americans to get together and make a change. The other most important thing that's happening right now for the safety of our country, the vitality of our country, the security of our country, is food. Okay? Had we not learned anything from COVID, one, we lost over 1 million souls. That's number one. Two, we realized that the people who died the most were immune compromised, elderly, in communities that was disproportionately despaired from healthcare access, fresh, whole seasonal food. And we come up and we create these fluffy names, such as, climate change, okay, and things like that. Let's call it for what it is. What happened there's no such thing as a food desert. There's no such thing, okay? But there's policies and procedures where there is apartheid, where there's no access to food, whole, seasonal, readily available, nutritious food. And so within that, yes, you have a compromised immune system. Yes, you have children with type 2 diabetes. Okay? Yes, because they're not getting the foods that they need and more readily affordable, available to them to make a difference. Yes, that food became very, very scarce based off of the transportation and our access to that. And then those who are most vulnerable, we then deem essential. All right? And they were dying at a higher rate. What are we doing? When are we going to change that? And the opportunity to change it, I believe, begins in two places, most importantly, in our schools and our hospitals. Every community has both. There's a public school, as in grammar school, where we need to start, and showing children where food comes from in the ground. That the tomato is not ketchup. Tomato comes in the ground. It's so important. The reason why I really got involved in this, I was talking about conscious cuisine. I was talking about how it's important, what I'm going to do about my family, how it affected me personally, how I'm changing, and how I can really impact millions of people rather than the tens of thousands I was impacting before. And a doctor called me out on it 20 years ago. So if you're really serious about that, come to my neighborhood. And she took me to Trenton, New Jersey, and I went to a YMCA, and they started talking about whole, nutritious, healthy foods. And I said, how can I reach these kids? Because if I don't connect with them right away, they're going to shut me off. So I'm going to make these really cool smoothies. I had a peanut butter and chocolate smoothie that I wanted to make sure it tastes like a Snickers bar. I had a blueberry smoothie. I wanted it to taste like a blueberry pie. And I had all these fruits and vegetables behind me. And this little girl came up. I really wish I remember her name. But she was about 8 years old. But I do remember those eyes was as big as a marble. And she said, "What is that?" And she had a raspberry and a blueberry for the first time in her life. Because what's available is an apple and an orange and a banana at school. And that's the only fruits and vegetables she's getting. So Chef Neff, when you're way here on this pedestal and you're talking about whole grains and seasonal vegetables, we don't have access to that. Okay? That's not in our neighborhood. They don't have blueberries and raspberries at the bodega. So homeboy, change your attitude. All right? This don't work this way. How do we make this accessible? So that's when I got on my horse and said, what do I need to do? How do I make recipes for food banks? How do I make recipes for schools? How do I make recipes that's going to reach healthcare? And the opportunity in healthcare is to make a change. The first thing I did when I came into healthcare is I questioned, who's making food? Okay? All right? And so the structure was that there wasn't chefs. They were production managers who produced food. She's absolutely right. I walked in and vegetables were made at 9 o'clock to be served at 7. All right? And so not only did I the first thing I wanted to do, and I did, I was successful in this, I eliminated the job title and the responsibility of production manager, and I sought out chefs. And this is how I hired the chefs. Why do you want to work in healthcare? I can get you a job in a restaurant. I can call my friend, and you can work down the street. But if you want to work in a hospital, you're here to make a change. I hire them on attitude. I'll train you. So the greatest opportunity is that if we have people with an attitude, because this is what happens is, here's the answer from their heart. I need to make a change in my lifestyle. My mom, my dad has diabetes. I lost my parents to heart disease. That's why I want to make a change. I love to cook, and that's why I want to work in healthcare. Those are the chefs I hired. But now I need to train them. All right? And so I created a certification program in order to certify those chefs. But just because you're a production manager doesn't require you to be fired tomorrow because you didn't meet my standards. So let me now give you the procedures, the tools in order for you to be successful to get to that next level. So what about if this curriculum was now embedded inside healthcare organizations all around the country and also schools? That we are certifying chefs in food and nutrition and wellness. Okay? It's so important. This guy here, as in talking about a change agent, I truly believe it starts with us. All right? As when I was telling you what happened with me inside a traditional restaurant, that meant that it's now out in the masses that is more acceptable when they come there. Okay? That we're making those opportunities. Thank you. Jose Andres. That's my mentor. I met him a couple times, but to me, he's the cat's meow. Because the difference is that's being aggressively doing it. And so the reason why I've been successful is that I've been smart enough to partner with extremely smart dietitians who think outside the box and says, yes, you can, and challenge me to help me learn the difference in nutrition. I stay in my lane in food, what's going to taste great, and they're guiding me on balanced nutrition. Jose Andres basically said, I'm just going to feed the world. He's the first one in, the last one out of Katrina. First one in, the last one out in Puerto Rico. First one in, the last one out in Haiti. But he's creating a model that can change FEMA of how we respond to national disasters. That is now not going to happen every 3 to 5 years. That has unfortunate opportunity could be every year. Okay? What if we change and create a model, a new model that's going to erect what food service is going to be in the future? I met this gentleman, Josh Tetrick, who is the founder and president of Just Foods, Just Egg. And one of the questions he brought to me early on when he was trying to introduce himself within the organization I was in is, what would it be like if we were to start all over? And that question was about the entire food system. Start all over. Can you imagine if we had the opportunity to think about starting all over and without anything that's encumbered us? Don't worry about the cost. Don't worry about what you can't do. All right? Just if we had a chance to start all over. Would our food come? Where would our food? How would we get our food? How would it be harvested? All right. All right. What is our why first? And starting with, when we're going to start all over, we have to define what's important to us. And I'm putting up these items, and I believe you share the same vision that I have. But again, it starts with a lot what Karen Washington said. And so if you drive through the United States and you see the dirt in the fields, do they become soil again? And we have multicultural plants. Okay? All right? And so now we're harvesting and we're now looking at regenerative agriculture in order for us to have clean food, all right? Clean air, clean soil, fresh soil that produces more nutrient-dense foods. All right, foods that's not only going to not only taste better, but be better for us. So regenerative agriculture, as I close, prioritizes soil health by simultaneously encompassing high standards for animal welfare. This is crop utilization and crop rotation. All right, this is how farming used to be. Okay, instead of we're paying farmers not to grow, and that there's barren fields. This is a way in which we can combat not only global warming, all right, but also change the effectiveness of the foods that we eat and providing something that's not only good for you, but is also good for the earth. So I leave you with, what would it be like if we just start all over? Okay, what would our restaurants be like? What would our hospitals be like? What would the food in our grocery stores be like? What is our chefs and our dietitians? What is their promise and their opportunities? Right? If we were to start all over with the emphasis on health, wellness, sustainability, accessibility, and affordability for everyone. I'm Chef Cary Neff, Conscious Food Solutions, and I thank you so very, very much.